Na mtazamaji, turejelee masuala ya afya hususan kuhusiana na migomo. Tuelekee walipo viongozi wa vyama vya wahudumu wa afya humu nchini. Katibu mkuu wa KMPDU Atela anazungumza hivi sasa. Hebu tumsikize.
That these salary delays has caused unforetold suffering among the healthcare workers in these particular counties. These workers are unable to pay their rents, to fuel their cars to the hospitals, or to pay their daily utilities. These financial difficulties cannot be explained in these particular counties when the employer demands them to be at work while disregard the responsibility of paying them on time. And therefore we are saying that we will not continue seeing our members in these counties straining to go to work where their salaries are ignored or their welfare is ignored. Secondly, lack of medical cover. We have noted again with a great concern that about 40 counties across the country, including the counties that I've just mentioned, have contravened Section 34 of Labor Relations Act, where all these health workers do not have any medical insurance. And therefore, as much as they work in these hospitals, they are unable to support themselves and to get the care that themselves provide. This is the highest level of negligence that we've seen in the counties. Despite the recent strike that we've had from different health sectors, these counties have decided not to honor the agreements, not to honor the CBAs, not to honor the return to work formulas, and therefore we are demanding for the medical insurance for the health workers in those particular 40 counties immediately. The non-remittance of statutory deductions. We have also noted with concern the frustrations and the suffering of our members across the 40 counties, where the statutory deductions have not been remitted. To some counties, even up to 2 years, particularly Taita Taveta County, where as we speak there is health worker strike. We have seen that SACCO deductions have not been remitted. We have seen bank loans have not been paid. And this has resulted into disillusionment among these particular members across these counties. And it is impossible, it is an injustice, it is immoral for the same counties to expect those particular workers to report to work when their deductions are not being remitted. Therefore today, with all the unions, we have decided to give the county government's demands and say that things will not continue as normal when the plight of the same people that are expected with the hospitals are ignored. On comprehensive medical cover, we demand that all the counties that do not have comprehensive medical cover to ensure that it is installed or procured within 14 days from today. On the counties that have not paid salaries for the months of June, the months of July, and the months of August, to do so in arrears within 14 days from today. We have also asked that all those counties that illegally have been withholding the statutory deduction for all the workers to remit the same within 14 days. Otherwise, today we are saying that all the health workers, that is the nurses, the doctors, the clinical officers, the lab technicians, the morticians, and everyone, and the public health officers will be out of work as they demand for the justice to be implemented, as they demand for these things to be implemented, as they demand for their monies that are illegally withheld to be released. This is the notice that we have given today, and we ask the counties to wake up and be accountable on this immediately. Thank you. Comrades, power!
Power!
Comrades, power!
Power!
Solidarity forever! Solidarity forever! Solidarity forever!
Na bila shaka ni viongozi wa vyama vya wahudumu wa afya humu nchini wakiwa wanatoa maelezo ya masuala ambayo wanahisi hayajaweza kutekelezwa na baadhi ya kaunti. Daktari Davji Atena ambaye ni katibu mkuu wa KMPDU alikuwa anazungumza hapo. Brenda Wanga anafuatilia taarifa hiyo na atatupa maelezo zaidi katika taarifa zetu za baadaye. Kwa sasa tupumzike kidogo tu na rejea hivi punde na mengi zaidi.